Long day. Holding your stomach there, I get it. I think I know why. You must be hungry for this week's video. Okay, I'm sorry, jeez. Aren't you supposed to be better behaved when you're fasting? Hello and welcome back to my YouTube channel. Today we'll be looking at fasting during the month of Ramadan. This is a month where typically many Muslims would be fasting, which among other things involves abstaining from food and drink from dawn until sunset. Yes, that includes water too. There's more to it than that, of course, but for this video we'll be looking at what this means for patients who take medicines and the sort of discussions worth having. These days in the UK, as Ramadan falls in April, it means breaking fast at sunset would occur quite late in the night, and beginning fast at dawn may be quite early in the morning. There are religious exceptions for who does not need to fast, including those with some medical conditions, those on travel, and those who are ill, but you may find that some patients may choose to fast in any case depending on their own beliefs and understanding. Remember, it's not only Muslims that may choose to fast, and these considerations can extend beyond just fasting in Ramadan to other types of fasting. So, there are a few things to consider here as a healthcare professional. So we'll try with the acronym SUNRISE. Number 1. Safety. Our role as healthcare professionals is to appropriately advise and inform patients with regards to their health outcomes as well as the safe and effective use of their medication. Considerations need to be made as to whether a safe plan can be made to allow the patient to fast. There are a lot of factors to consider, and it's important to explore the different options and assess the risks and be able to discuss these. They might include risks related to a patient's medical conditions, their medicines, as well as the risks of not eating or drinking for a long period of time. Special considerations include women who are pregnant or breastfeeding, elderly patients, and children who may be fasting, as well as those identified as being in high-risk groups such as those with type 1 diabetes or heart failure. We can have a good assessment of the risks of each patient by getting a better Number 2. Understanding. It's important to build a relationship, gain trust, and try to work with each patient to try to avoid situations where they suddenly decide to stop taking the medicines or try adjusting doses, frequencies, or timings themselves without informing a healthcare professional, as they may be putting themselves at risk. One less obvious form of signposting may be to contact or ask the patient to get in touch with a trusted local mosque leader or religious authority if they have one, about religious rulings. In some cases, for example, it might be more appropriate for some patient groups to work around an alternative, such as making up the fasts in winter months, and a patient may feel more comfortable with that if they better understand their religious permissibilities and speak to a local trusted religious authority, as well as understanding what it means for their health. Typically, those fasting may have a meal twice a day, once after sunset, this is known as iftar, and once before sunrise, known as suhoor. However, each person and their routine during fasting may be different, so it's important to understand their plans and their lifestyle. It's also important to understand their conditions as well as their medication regimens, whether the treatment is short-term for an acute condition or more long-lasting for chronic conditions, and the implications for each. For example, patients with diabetes may require more frequent blood glucose monitoring, and awareness of the signs to be aware of in case their sugar is falling too low and they may need to break their fast, as well as any potential adjustment to their medicines. Getting an understanding of the individual, their medical conditions and medicines can give a clear idea of what to do next. Number 3. Nature of current medication. Can the patient still take their current medicines within the period of time they have to break their fast each day? So, this depends on the nature of the medicines they currently take. If they take the medicines once a day every morning, they might be able to just change the time that they take it, to either at sunset after they break fast, or before sunrise before they start the fast for the day. This can get more complicated with medicines with multiple doses. As a healthcare professional, you'd need to consider whether they can appropriately take the doses and if it can still be safe and effective. For instance, where the interval between breaking the fast and starting the next day's fast in winter months may be around 12 hours, this presents less of a problem than during times of the year, such as the current times, where it's around 6 or 7 hours, due to the way the medicine works and the dosing intervals of the medicine. With that said, with some medicines it's still possible to have effective treatment of 2 doses in these time frames. However, if it isn't possible, number 4. Regimen changes. Can they be changed to an alternative dosing regimen for the same medicine? Sometimes, if the prescriber is happy to, some medicines are also available as long-acting formulations, where the dosing is less frequent and the medicine is released throughout the day. As an example, a medicine that would usually be taken twice a day, for instance, can be available in a modified release form that would only need to be taken once daily. For instance, metformin tablets may have a dose of 2 to 3 times a day, but the modified release preparation may be once daily with the evening meal. Number 5. Interchangeable dosage form or medicine. Okay, I admit it, I couldn't think of a better one for I. In some instances, there may be other forms that are generally considered not to break the fast, as alternatives to the oral dosage forms. That might be, for example, a patch or drops. There may not be that many situations where this applies, but it could be, for example, pain management with opioid patches where the tablets would have been supplied. If not, then we go down to, is there an appropriate alternative medicine in the same group that can be considered, which may have a different dosing regimen. Number 6. Signposting and other services. The idea of the month of Ramadan is not just one of abstinence, but a message of improvement and transformation. The idea of self-improvement and working on one's virtues and character is at the heart of fasting, not just abstinence. Like any other form of habit forming, this may present a great opportunity for signposting and other services. It is a great time to educate on healthy eating and public health, as well as other positive habits. Because the duration of fasting is a month, this can present lasting changes. An example of a service that may be very useful this month as well is for regular smokers. In Ramadan, they may smoke less because they can only smoke between sunset and sunrise, so this may present an opportunity to reduce or stop smoking. Number 7. Eid, or end of Ramadan. At the end of the month is a celebration known as Eid. The specific day may vary based on religious followings. There is a great emphasis on community, spirituality and betterment, and the celebration and continuation of the good habits and practices established during the month. So, as with all endings, let us positively reflect on this month of giving, of generosity and kindness, of sharing, by sharing this video, liking and subscribing. Shameless, I know, even for me. Anyway, I hope you enjoyed the video, and as always, I hope to see you next week.